In the previous episode, I spoke about women who develop diabetes in their pregnancy in the third trimester and what complications can occur from it and what care is to be taken. But there are a lot of young women who already have diabetes and now want to become pregnant. And it's important to know what to do. When diabetes is already present and a woman conceives and the sugars are not controlled, particularly in the first few weeks of pregnancy, this can be a catastrophic thing for the baby because all the organs in the baby develop in the first 2 to 3 months after conception. So the sugars need to be very well controlled, which means that sugars need to be controlled even before you conceive and not only after you know that you are pregnant, because pregnancy diagnosis is often made about 6 to 8 weeks after conception. So all this begins as a preparation at least 3 to 4 months prior to conceiving. One also needs to know that most of the oral tablets that we use for diabetes treatment are not allowed in pregnancy. So what we need to do is, for anyone who wants to become pregnant, we need to convert them either to metformin or added insulin, because these are the only two drugs which are allowed in pregnancy. And this transition needs to start off much before even the planning of pregnancy is begun. Also, for women who have had diabetes for some years, we also need to make sure that their eyes and kidneys are completely normal before they conceive, because there does seem to be a little amount of worsening in pregnancy in patients who are already diabetic.